This study is called ERA-223, and this is a trial, which is a large randomized trial comparing men with metastatic castration-resistant prostate cancer treated with a combination of abiraterone, prednisolone and radium-223 versus abiraterone and prednisolone and a placebo. So these were patients with progressive metastatic castration-resistant prostate cancer involving the bone. They had not had previous chemotherapy, so essentially it was first-line therapy in metastatic CRPC. The patients then were treated with 6 cycles of radium-223 or 6 cycles of placebo, along with abiraterone acetate and prednisolone. The study aimed to try and determine a prolongation in time to symptomatic skeletal event, so pain in the bone, spinal cord compression, fracture requiring surgery, and also looked at other endpoints including overall survival. Now, the study actually was unblinded back in November last year because the Data Monitoring Committee had identified an increased risk of fracture for the combination of radium-223 with abiraterone, and also a trend towards worse survival in the combination therapy. Now, updated analysis presented here at ESMO shows that the survival difference is now not significant, so there's no difference in survival. However, most certainly there is an increased risk of fracture for patients starting abiraterone acetate and prednisolone along with radium-223. What's become very apparent from the study, so essentially it was a negative study. The combination now could not be recommended. It does not seem to improve survival or to improve time to radiographic progression or indeed symptomatic skeletal event. But what it has done is unearthed some very important information around bone health in these patients. So we know that elderly men, especially treated with androgen deprivation therapy, have a higher risk of osteoporotic fracture. And certainly in this study, there was a higher rate in the radium-treated patients. About 30% of patients had an osteoporotic fracture. In the abiraterone and prednisolone, it was about 10%. Now, both these rates could be reduced significantly if men were also treated with a bone health agent. For example, zoledronic acid, denosumab, or another bisphosphonate. So the rate for radium patients went from 30% down to 10%, or 14%, and for the abiraterone patients the rate went from 10% down to 5%. So I suppose the takeaway message from the trial is the combination of abiraterone, prednisolone and radium is not recommended together, and also that bone health agents, we really should be paying a lot more attention to bone mineral loss in these patients, and strongly recommending that the guidelines are followed, that patients in this kind of risk category should be receiving a bone health agent to reduce their risk of osteoporosis. Because even in patients treated with abiraterone, a 10% rate of osteoporotic fracture is pretty high. So following on from this, it's unlikely that this combination will be tested further, but I think we need to gather further information on the bone health of these patients. And the implications in the clinic are patients on long-term ADT and patients on abiraterone, but also likely the other hormonal agents and chemotherapy agents in prostate cancer. Patients should also be on a bone health agent to reduce their risk of osteoporotic fracture. And patients should be assessed at baseline of therapy to assess their overall risk of fracture. There's a score called the FRAX score, which can help determine patients' overall risk of osteoporotic fracture, and patients with a more than 1 or 2% risk of fracture should certainly receive a bone health agent.